All right, once again, for all of you just joining us that have been moving from the other sessions in our Medicare Education Expo today, my name is Leanne Foster, and I am a member of the Provider Outreach and Education team here at WPS, and I'd like to welcome you to our third session in our Medicare Education Expo focused on LCDs and NCDs. In this session today, we are going to be talking about navigating the Medicare Coverage Database. Couple of small housekeeping items this morning. First, materials for today's event. They were handled just a little bit differently. They were not posted to our website. They were sent out via email this morning to those of you that were registered. If you registered closer to the event in the last hour or so, you may not have received that. I'm certainly going to ask you to reach out to our education mailbox, and some links are going to be placed in the chat for that, we can send that presentation to you. I also mention that this session is being recorded, and this presentation will be available on our Encore presentations page for the next 60 to 90 days without needing to access the YouTube player. After that, it will be available on our YouTube channel. One other thing that I did not mention at the beginning of this session is audio. You should be hearing me, but if you are having technical difficulties, I have asked Aline to place some information into the chat, which includes a phone number and an access code. That phone number and access code is going to allow you to connect via phone. However, you can continue to listen through your computer if you choose to today. That's perfectly fine. However, if you are also continuing to listen to this session through your computer audio, I will encourage you to jot down that phone number and that access code just in case you run into any glitches with your audio. That's going to allow you to connect to the audio for this session so that you don't miss anything today. Questions today. We did receive a very positive and strong response to our sessions today, and we do have a lot of people registered, and with that came a lot of pre-submitted questions. I want to thank those of you that submitted those pre-submitted questions, and we will be addressing those in the session today. In fact, many of those pre-submitted questions were specific to navigation that we are going to be demonstrating today. So we did craft the material for today around those pre-submitted questions. If you have questions, we will address as many as possible. They can be submitted through our chat feature today, or they can be sent to that WPS GHA Education mailbox, and we will send responses to you. Also, after the session today, we would like your input. Today is something that we are offering for the first time, which is a large-scale educational event delivered virtually that has multiple sessions that are focused on one specific topic to kind of give you that start to finish experience and information on LCDs and NCDs today. With this being a newer session, and as with all of our education, we want your input, as your input drives what we do with our education and helps us improve future education that we offer. So at the end of this session today, you will be provided an opportunity to offer that input through a CMS survey telling us how we did today. What did you like about this session? What would you like to see in a future session? How could we improve this session for you to make sure that it is relevant and meeting your needs and useful to you, and that you're finding that value in that session? It is a CMS survey, but we do look at all of those results, again, to make sure that we're adjusting our education to meet your needs. This is also an opportunity for you to provide us with feedback on topics that you would like to see in the future. Those topics could be related to the LCDs and NCD information we're talking through today. They could also be future topics that are outside of the scope of that LCD and NCD topic that you'd like to see us offer. Again, this is your opportunity to help us customize the education that we offer for you. This is just our typical disclaimer for our education. All of the material presented today is accurate as of today, and if you've worked with Medicare for any period of time, you know that Medicare changes, and it changes often. So I'm going to encourage you to continue to monitor our official CMS communications, which includes our website, just to make sure that you're complying with all current Medicare rules and regulations. Also, CMS does prohibit the photographing, screenshotting, or recording of the session for profit-making purposes. And as I stated earlier, we are recording the session today, so it will be available for you after the session. Should there be something you want to see again, something you missed, or if you find information in this session beneficial and would like to share that with someone else. So that brings me to our agenda for today. Now, if you've attended multiple sessions today, you have seen the Medicare Coverage Database. Karen and both Mary Sue did show some navigation within inside that Medicare database, but there's a lot more navigation than the little bits and pieces that you've seen. So this session is meant to help you with providing, or we want to provide an understanding of the navigation and how to use the information in the Medicare coverage database. So the things we're going to talk about, certainly, we're going to show you how to access the Medicare database. We're going to show you how to best navigate that. We will walk through how to navigate both current and archived articles and coverage decisions, whether they're local or national coverage decisions. So those will all be out here. We're going to show you what's available out there. As I mentioned, LCDs and NCDs will be available, both draft and final, archived, and also articles. And we're going to show you how to use the information available. We're going to assist you in breaking down how that LCD is laid out, but we're also going to show you some resources that are available to assist you. Now, throughout today's presentation, I am going to be actively demonstrating the MCD. So you will see me bounce back and forth between my presentation and the website. I want this session to be as interactive as possible. So if it would appeal to you or help you in learning the MCD navigation to navigate along with me, then certainly feel free to do so. I am going to be using a lot of acronyms, as with many facets of our life. Medicare is a little bit of an alphabet soup when it comes to acronyms. So to help you today, I have included a list of the acronyms that I am going to be leveraging today. So to start, I want to talk about what is the MCD. What is the Medicare Coverage Database? So the MCD is a national searchable repository that will help you as a user find coverage documents related to what's covered and what's not covered by original Medicare. If you attended previous sessions today, you heard both of my colleagues, Karen and Mary Sue, talk about how even national coverage decisions are decisions that are made by CMS, and all MACs must comply with those coverage decisions, but there are also local coverage decisions. And those are coverage decisions that are identified and created locally by individual MACs. Even though those local coverage decisions might be created by specific MACs, and we do provide links to those LCDs on our website in varying resources that are available, all of those, both national and local coverage decisions, along with articles and drafts and companion articles, are all housed inside this national CMS repository. So everything's in one place. There's not a need to maneuver from MAC website to MAC website. That would certainly be cumbersome and unhandy to have to search individual MAC websites for their local coverage decisions. So the MCD allows for that central storage location where you can see coverage decisions that, again, are set by CMS, WPS, or other MACs that have established those. Now, these documents are going to benefit you. This is one question that we did get as far as claims processing and submitting appeals, because they're going to show you what coverage decisions are available for varying services. So it'll outline, anything that might be different based off of your geographic area if it is a local coverage decision, or anything that CMS has communicated with the MACs as far as coverage. So why use this MCD? Again, you're going to want to, it's going to help you understand Medicare coverage better prior to providing those services. So to submit claims correctly, it's important to understand what Medicare does and does not cover. Based on law, Medicare can only make payment for items and services that are medically necessary. If the provider doesn't give the patient acceptable written advance notice that Medicare will likely deny the service or item, the provider is financially liable. However, on the other side of that, if the patient receives proper written advance notice that a Medicare service will likely not be covered or Medicare will deny payment, and they can show action on the claim, Medicare may hold the patient liable. Now, how do you know that? And it's important to know ahead of time before you submit that claim whether or not that service is a covered service. Certainly, our internet-only manuals and our benefit policy manuals lay that out, but local coverage decisions and national coverage decisions all play a part in that. And because of this extensive information that's out there regarding coverage, CMS does expect healthcare providers to know Medicare coverage requirements and anticipate payment denials. And using the MCD will help prepare you, your coders as a provider, as a health system, submit correct claims and anticipate those possible denials. So who uses the MCD? So the MCD can be utilized by healthcare providers, healthcare professionals such as billers and coders. It is utilized by MACs. It can be utilized by Medicare beneficiaries. Essentially, anyone can leverage the MCD if they have that need. The MCD is a publicly available resource. It is not something that you're needing a user ID or a login to gain access to. So anyone who would like to view the information regarding NCDs, LCDs, again, whether draft or published, archived, or even articles and companion documents, can access that information from that MCD. So first and foremost, you need to know where the MCD is. Now, I've included resources and links regarding the MCD throughout the presentation materials today. So let's talk about accessing it, and then we'll start exploring the MCD a little bit. So the MCD is available on CMS's website, and I have included a direct link to the MCD that is in the title that you see above the image on the left. And then I've also included a link through CMS's homepage. So let's show you what that looks like. And there's a multitude of ways to access it. So first and foremost, you will need to access the CMS website. From here, you can access the MCD through the Medicare dropdown. And you can see it through, oh, sorry, went to the wrong place. My apologies. Scroll down, and you're going to go under codes for claim reimbursement. Wrong drop down, my apologies everyone. And there you're going to see the list for the Medicare Coverage Database. And by clicking on that link, it's thinking about it, it's going to take you directly to that MCD Coverage Database. The other thing you can do, you can always search for it. And I don't even have the whole thing. I'm a searcher. I typically search websites. So you can search for Medicare Coverage Database. It will show up in your search results, and it will take you to the same place. So there's a multitude of ways to get to that MCD. Once you are in the MCD database, the next question becomes, how do you search through that? Now, there's going to be a couple of options for you to do that. We're going to talk through those, but there is some basic navigation. In your materials for today, I just want to show you the slide that does show you the base of the MCD. And at the top, you'll see I've got a red box around the navigational features that we're going to talk through today. So let's go through those. At the top, you are going to have options to search, which is also going to be essentially that home page for that MCD. We'll talk through some searching here in a few minutes, but you can search. You can pull up various reports on the MCD. So if you're wanting to look at final MCDs, LCDs, proposed LCDs, you do have access to search for those. One of the pre-submitted questions that we received is how to know what's coming up. This would be a good place to pull a report for things that are being proposed but are not otherwise final just yet. So it just depends on what you're looking for, but you can find all that information kind of in one handy dandy place. Now, downloads, we are going to talk about that in a minute. You can download various data sets from the MCD if you have the need. It does open up information in zip files and allows you access to an access database. We'll talk about that a little bit more, but that is what you would use that download for. Next, you're going to see this basket. This is something we're going to talk about when we talk about saving articles. If you find there's an article that you reference often, sometimes, do you really want to go out and search for it every time? There is a way for you to save articles so that you can easily access them in the future. And we'll show you how to use that in a little bit. You also have this help icon here. This is a helpful tool if you're looking for resources to help you navigate the Medicare Coverage Database. So if I click on Help and Resources, it comes to a page that shows you a bunch of various cards with various information and help topics in there. Just some resources that can help you when you're navigating this. If you're new to this, there's something that you're struggling with, there's a lot of great information out here. The other thing you are going to see is there are two tours that are listed out here. One is a tour of search, which will actually take you through, and I'm going to end it, but it actually takes you through a step-by-step tutorial of how to navigate the LCD database's search function. We also have one available if you want to leverage reports. There's also a tour that's out there that is available for leveraging reports. So a lot of good resources out here that will help you as you begin to use the MCD maybe for the first time or just utilizing it more. So next we're going to go into how to search for articles. So when you're in the MCD, you can search for articles by a multitude of ways. So it's going to allow you to search by keywords, specific CPT codes, HCPCS codes, diagnosis, so those ICD-10 codes, and also the document ID if you happen to have it. Now, if you attended our last session, Dr. Vlahakis pointed out that not every piece of, or every covered service has an LCD. So that's something to keep in mind. If you're not finding something out here, it may not have an LCD, it may not have an NCD, which would typically mean which does mean that we're following the guidance that's laid out in the benefit policy manuals or the other internet-only manuals that are out there. So just because there's not an NCD or an LCD doesn't necessarily mean it's not a covered service. It just means that a separate coverage decision from those internet-only manuals has not been issued. So on this search page, there's a couple of things. You do have a notice board that's just going to give you some updates and just a couple of other links to information that might be helpful. Beneficiary websites, if a beneficiary is here, maybe they actually need to get to the Medicare.gov website, so that's here as well. And also if there's any information regarding public comments. Those are informational links for you. You also see that there is another resource right front and center on how to use this database. So to search, I am going to search by a couple of things. First, I'm just going to search with a keyword to show you how that looks. And you can not only search by keyword, but you can narrow it down by specific jurisdictional states. So that is a filter. If you want to start that on the front end, you have that option. I'm not going to. I'm going to leave it at all states for this demonstration. Once you're here, this is what the search results are going to look like. And in your presentation materials today, or the training materials for today, you are going to see that I have the structure of that search results page laid out, but I am going to cover it here on the website. So a couple of things you're going to see in the first column. It's going to give you the ID, and that ID is going to be a link to that article. So to access that article, you will click on that link, and I'll show you that in just a minute. You're going to see the title of the article. You're going to see the type. So this is going to tell you if it's an LCD, local coverage decision, or an NCD. And if you'll see here, if I scroll down, we have all sorts of things. We have LCDs, we have NCDs, and we have articles. The next column is going to be super important. This is the contractor. I'm going to show you a way to filter this, but the contractor, especially if it is an LCD, is super important because it is going to be something specific, a coverage decision specific to that contractor. And you'll see on the screen here is that we do actually have LCDs that are both by WPS and other MACs. So to make things easier, I'm big on filters. I want to narrow down those searches and make it really efficient for me to find the information that I need. So a couple of things, you can come into document type and you'll see you have selections where you can actually narrow down which documents the MCD is looking for. I'm going to leave it at all document types at this point, but if you wanted to just look at final LCDs or proposed LCDs, that could be something that's very helpful to you. Jurisdictional state, you have that option here again. And that's helpful, especially if you see something that is, say, for your contractor, it's for WPS, but you're looking specific to see if there's something specific for instance, J8, Indiana. You can narrow it down. The one that I use most often is going to be the contractors. It defaults to all contractors. I'm going to go for contractor name, and I am just going to look up articles that are LCDs for WPS. So I click on that and you'll notice my search results change. And you'll notice in the contractor field, everything is for WPS. So that is one of the that's the easiest way in order for you to navigate those results. And what you will see in your material today, I did include some information regarding how to utilize those filters to refine that search so that you have that for reference. So as I mentioned, you want to access that article, and that is going to be done through the ID, and that's whether it is an LCD, so that's a coverage decision, or it's an article, whether it is a draft. In fact, I'm going to do a search to show you what that would look like. So here's how it would look a little bit different if you have a draft LCD. Typically LCDs are going to have that L in front of them, but if there's also a D, that means that that is a draft LCD and not yet in effect. So that's just something to keep in mind. I'm going to go back to our allergy. Still have my filters. You can see as I navigated and moved around a little bit between articles and coverage decisions, my filters stayed in place. So I'm just going to go into this first LCD. And this is going to be that local coverage decision article. Now these can be really long. They can include CPT codes and diagnosis codes. They may not. One of the easiest ways that I have found to navigate these, you can scroll, but that kind of gets to be a little tedious and a little bit much. You can actually do a search if there's something specific that you're looking for inside of this. But typically, if you've done that, that's probably the keyword that you've used to find the article itself. The left-hand side you're going to see is basically a table of contents, and this is going to let you navigate through all of the information that's contained in the LCD. So for instance, here I'm looking at the LCD information. It'll even break it down to, I want to just get to that LCD ID. So basically everything that's green, everything that's a heading is going to be a jumping point. If there are diagnosis codes and CPT codes included in an LCD or an NCD, there will be a jumping point to those codes. So that is a really efficient way to get down to that information. Now, coverage guidance, I'm going to jump down to that. Actually, I'm going to go back real quick. I want to look at the original effective dates. This is really good to make sure that you're paying attention to the effective date. If there are any revisions, those will be listed here. Revisions, there is a version history for information down at the bottom that will tell you if there was a revision. It'll tell you what the revision was on that corresponding date. And then it'll tell you if it's there's a retirement date. This one doesn't. That means this is still an active LCD. So just a lot of good background information to help you know if this LCD or NCD applies to your scenario that you're looking for. Once you're in here, you're probably going to spend a lot of time in coverage guidance, and that's where I'm jumping down a little bit. Here, it's going to talk through the LCD or the NCD. It's going to give you base information. It's going to include any coverage indications, any limitations, or medical necessity information that's included in the NCD. And again, as I mentioned, not all benefits or coverage policies are going to have an LCD or an NCD, but if they do, that information is contained in here. I know if you attended the last session, V talked about the evidence and the analysis of that evidence, that information, that background information of what was looked at when creating this LCD or NCD is also included here. So a lot of really good information here. I went back too far, one moment. And I'm just going to refilter. Okay. So once you're in the LCD, again, I mentioned earlier that, you find one that you like, you would like to save that. You're maybe going to reference that as a resource, and you don't want to necessarily have to keep track of how you search that or that article. You do have a way to keep kind of what I would refer to as a customized library for yourself of the articles that you see all the time, or use all of the time. Something you're going to notice, they have included a screenshot of that highlighting how you're going to do that save in your materials for today. So once you're in an article, and you do need to be in an article to save a specific article, but in the upper right-hand corner, you're going to see a couple of items, and you do have a couple of options. The first one's going to look like a little email, little envelope. You can actually email a link of this LCD or NCD or article to you, or to, if you have your team that maybe needs access to that, so to somebody. So you can go ahead and email that information. You can also download that document if you'd like to, if you need a copy of that, and that'll allow you to store that in a location. The other item, though, to save them is add to the basket, kind of like online shopping. It doesn't say save the document to your library or anything like that, but by adding that to your basket, and I want you to pay attention to the basket up in the navigation bar, by adding that to your basket, you'll notice that my count went from 1 to 0. So I'm going to go out to the front search of the MCD. I'm no longer in that article. You come in, it is going to save to that basket. So in order to access those documents, you are going to want to access the basket at the top of the navigation bar. So when I go into that, there's the article that I just saved to that basket. There's not a limit to how many you can save. Certainly, you're probably not saving the entire database for NCDs or LCDs, but if there's some that are hot topics you're using often, this allows you to go into them and get into them quickly without having to start your search over. Now, certainly, once you save a document, you may want to not only access that document, as we just talked about, but you may need to delete that document. Maybe something has been archived. Maybe you no longer need it for a resource or a reference. Maybe you've done your research, what have you. You can empty the entire basket by using this recycle bin. I do point that out because maybe you only want to remove one. I don't want anyone to accidentally completely remove every article that they have in their basket that they have saved, because then you have to go back and rebuild those shortcuts, if you will, and I'd hate to have you have to deal with that. So I'm going to go ahead and delete this one. I'm just going to make sure that I'm on the line, and you'll notice that jumping to those LCDs, it looks a lot like your search results. So I'm just going to remove that, and my basket is now empty. I'm going to go back, and I am going to add that back in as one other thing I want to show you in that. Add to the basket. I'm going to go into my basket. Maybe you're in your basket and you realize, somebody's looking for this resource. I have it. You have it as a jump or a shortcut, which means you also have access to it more quickly. Maybe you want to send that to somebody. You do have the option to email your basket from here as well. Now, if you email your basket, it's going to be all the links. Okay, so if you wanted to email the individual LCD, you do need to be in that LCD in order to do that, to email just this document. What I'm showing is going to email the entire basket. So if you have 2, 4, 10 articles, what it's going to do is it's going to email links to all of the articles that are in your basket. You can also create a link to the basket itself if you would like to send that versus emailing everything in the basket. So a couple of different options to share that information inside your organization with your team, whatever is going to be most useful for you. So next, you are going to run into instances where you may find you need to access an archive document that's no longer in effect, and you can. If something's no longer in effect, it does not go away. It is not deleted from the MCD, but it is housed separately from the active and the draft LCDs. And so I'm going to show you that. One moment. There we go. So from here, what you're doing is you're going to access the archive that is in the navigation bar at the top. You click on archive and you are going to get a message that's telling you that you are leaving the MCD and you're now going into the archive. They're two separate databases, but they do function the same. So I'm going to go ahead and continue to that. Now, you haven't seen it on mine because I have accessed this database and I access it quite frequently. So one thing that I do want to point out that you haven't seen, and you'll typically get it when you go into the archive, is a license agreement going into that. So it's just something you have to accept to continue to use that database. We see that when we access our MAC website with the AMA license agreement. It's just a very similar license agreement. So the nice thing about the archive is that it does kind of scream at you that you're in a different database. If you look at the header, you're going to see a very similar navigation bar, but it's going to be yellow or orangish yellow. So it's showing you that so that you know that you're in the archive. These are NCDs, LCDs that are no longer in effect. Layout is going to be very much the same. You're going to see the same notices. You're going to see the same access to additional information. We mentioned before, if a beneficiary were out here, and again, they can access that, they may need to go to Medicare.gov. So there's a lot of the same features here. You can search by keyword, code, or document ID if you have it. And I'm just going to search by allergy again. And I'm going to use those same filters. Does not seem to know what it's thinking about it. There we go. Contractor name. And I'm going to go to WPS. One thing you will notice when you look at the all contractors, you may see contractors that aren't familiar. And again, this is an archive, so it keeps everything out here. Here we're looking at our various articles and drafts. You'll see right away I've got a couple of drafts, but it is going to let you know, and you'll be able to access it through that same link. Here's that license agreement, because I haven't gone into that article. But it will let you know, I'm going to go back to the dates. It will show you where it was no longer in effect. Now this one doesn't necessarily have a retirement date because it was superseded. If you run into that situation, it will give you a link back to where you need to be to find the item that is superseded. So the LCDs and NCDs, again, they're in a national repository versus individual repositories for the various MACs and CMS. So everything is linked. I go back one, and I'm going to go to one that is retired. Here's one that was retired, and here you can see there's that retirement date. And you'll notice at the top, it'll tell you that it was retired. The last one said it was superseded, so it gave you a link of where to go from there. This one is just retired. One thing you'll notice too is I went to the archive versus the current. You'll notice in mine, it will open in a separate window. That way you don't have to necessarily go all the way back. You can have the active MCD and the archive open at the same time. I mentioned earlier reports, so I just want to talk through those just a little bit and how those are used. So for reports, you're going to access that at the top of the screen. There's going to be that reports, and this is where you can go ahead and grab, I'm going to do the proposed reports. I'm going to do a proposed LCD by contractor. And here you're going to see that it's going to be a lot by, or it's going to be look a lot like the search results. And it's going to function the same way. You have the link, you have the title. It's going to default to all contractors. So under the filters, I'm going to go to all contractors and click on WPS. Now with the reports, you can also narrow it down by contract. I'm just going to leave it with all of them. And here you can see the draft LCDs that we have out there. If you attended the last such session, this DL 39909 was one that we looked at, and you can see that draft and see where that stands. So that is all out there. You can pull that report just to help you know that this is what's up and coming. And that was one of our pre-submitted questions, so I hope you found that helpful. Also, when you go into a proposed LCD, it is color-coded, big and red, different icons. It does tell you this is proposed, so that means it's not in effect yet. It is a draft. Next, I want to talk about downloads. So as I mentioned earlier in the session, you can download the information that is in the MCD, and that includes all of the information that is there. Now, you may not have need to do this, but I want to make sure that you know that this is possible if you or your organization need to download these data sets. So to do that, just going to go back to the base session. To do that, you are going to navigate to the downloads menu across the top navigation bar. So you're going to click on that link, and you will be, if you've not accessed this previously, you will be asked to accept the licensure agreement for that as well. So this is another place that you'll see that. On the downloads page, you are going to see 5 data sets that are available for download. With all of these, you can click either the download data dictionary or the download data. Download all data sets is going to allow you to download all 5 of these data sets. So it just depends on what you need and what you need to download, which one you will access. So to download those data sets, and you will see that I did include information on how to use those downloads and download those. You're going to have a zip file that populates for you that is going to contain a README file, the dataset file, and an association data dictionary to help you understand that. That README file, if you've never downloaded this data set, is very helpful. It does walk you through how to access that information, so that's something to keep in mind. I'm just going to demonstrate downloading this. I am going to download for current LCDs. I am going to download that data set. And I did do that before this session just because of the size of the downloads. They can take a little bit. So one of the things that they'll do is it'll ask you how you want to open it. depending on your organizational setup, your system setup, will determine your protocol for downloading these data sets. Mine is just opening in a file explorer, and here you'll see those files that I just described. Here's the README first. Give that a minute to come up. And there it is on my other screen. One moment. So this is what that README file looks like. Again, it just walks through the different segments and provides some guidance on how this is going to work, okay, and the file types that are available within the CSV file. There is the ICD data dictionary. So this is going to provide some information on how to utilize this or what the data actually is to help you interpret that data. So this is something that you'll want to look at. And then the MDB file is the actual database and that data set, that information. As I said, it does upload into an Access database, and it is going to ask you to accept a licensure agreement on behalf of it. It does open in read-only. That is to protect the data set that is in there, and it does take quite some time to download. We're not talking hours, but it's not immediate. As you can see, it's still downloading for me. All right, for the sake of time, we're not going to hold that open. So once you get into that, those data sets, they are defined. They will allow you to select the data that you want to download. So as I showed you, you can go ahead and take the whole data set, or you open the zip file and you just download the pieces of that. If you're comfortable with downloading these data sets, you don't necessarily have to grab that README file, but it'll show you the zip files. Like I said, you're going to want to download that data dictionary and then download the data. And again, these are all zipped files. So that protocol for your organization may differ from how we download them and unzip those, but the information that is going to be included in there is going to be information that is going to be specific. Again, that data dictionary, as I mentioned, that's going to explain the content and structure of that database. There are going to be attachments that are going to show the NCDs, the articles, and any supporting documentation. You can access retired LCDs and articles. So if there are articles that are retired for less than a year, they'll be in that data set. If they have been retired for more than a year, you're going to want to use that MCD archive that we talked about in order to access those. But as I stated, they're not deleting those. LCDs, NCDs, articles, even the drafts that maybe weren't implemented, they're out there. So you have that information should you need it. Those are those historical versions. So with that, again, hopefully we addressed a lot of the pre-submitted questions. A lot of those were focused on the navigation and using the database efficiently. We've got just a couple of minutes, so I am going to check in with Lillian just to see if we have any questions in the chat.
Thanks, Leanne. That was great information. Yes, we actually did get a question from Kathy, and she says, if you don't need to log in to access the MCD, how does your basket save for future use?
It's a good question. It is tracking the computer that's accessing it. When I say that, it's just keeping track of your browsing history so it can see that you were there, and it is saving it into the basket. Now, I do recommend emailing the basket to yourself just as a safeguard from those being cleared out. Again, different organizations clear out that browsing history differently, so I do recommend sending that. If you send that as an email, you are going to keep that basket indefinitely because that won't be deleted from that. Excellent question, and thank you for that.
Thanks, Leanne. Another question came in. This one's from Roxanne, and she says, can you search by a CPT code? If it doesn't bring anything up, does that mean that there is not an LCD or NCD?
Yes, that is correct. So I'm just going to look up G2211. Excellent question. I'm going to go ahead and search that. And as you can see, here are my search results. So that tells me that that particular CPT code is not mentioned in an LCD or an NCD specific to that. So that would mean you'd want to refer to the benefit policy manuals and the claims processing manuals for the instructions on that, and also resources available on the CMS website specific to that, or your MAC's website. I think this one I looked up has one. I'm looking for one that's I know has one. I apologize, I don't have an example. But if that CPT code appears in an LCD or an NCD, it will bring up the articles that it appears in. That is true of the diagnosis codes as well. And I just see in the chat that one came through. So someone gave me a CPT code, and that is something that I am searching, and there's not an article available for that. And again, that simply means there's not an NCD or an LCD that is specific to that. I want to remind everybody this is the Medicare Coverage Database that's going to have expanded information to what's included in that benefit policy manual. This isn't going to be something that you will look up a code and it'll go through all of the coverage for that code. This is if there is additional information needed for coverage of those types of services or that benefit. Great questions, y'all. Do we have any others?
I got one more. Let me switch to my email here. Kathy asks, when something has saved to your basket and is then revised at a later date, does the saved document change to the revised version?
It should, because what is happening in those, and let me go to that. I cannot spell allergy today. There we go. Because it's the same article, so it's going to be that same code. Now, if this ID changed, it's not going to forward that link on. But because of the way we track these, I'm looking at the effective date, the revision dates, it's going to show you when it was revised. It is this article. It's not changing the location. And if it's not changing that article or that decision ID, it will be the same link in your basket.
And I don't see any other questions at this time.
All right, thank you. And we are running close to time, so I'll go ahead and wrap things up. So in a couple of minutes after you leave our session today, as you have with any previous sessions you attended today, you are going to receive an email thanking you for attending. This is going to be your certificate of achievement, so don't delete this without taking a look at it. If you're attending today's session for continuing education credits, this will serve as your certificate of achievement that will count towards contact hours for your certification or accreditation body. And you can submit this email to them and they can count those towards your continuing education credits. If you didn't get it, a couple things happened. You may be attended by phone and I simply don't have a way to systematically track your attendance and give you the certificate, or it could have gone to your junk or spam folder. So this is coming from our WebEx software, and if that's not on your safe sender list, it's going to get caught by spam and junk mail filters. So check that folder, but in either event, if you send an email to our education mailbox, along with the phone number you attended from, I'll verify your attendance and we'll go ahead and get you that certificate sent out. If you have follow-up questions from today's session, we are taking those for 7 days. You can send those questions to our education mailbox, which Aline has placed in the chat for me. Now, one thing that's going to be super important is that that subject line is in there because this is a large-scale event. We are seeing those questions come in for multiple events today. So please make sure that you're including the navigating the MCD as the subject line in order to make sure that gets to me so I can get those responses to you. Also, if you have the training material, I've made it super easy. If you click on that email link, it will open up an email that already has that subject line populated for you. Also, would appreciate you taking the time to provide us some input and comments regarding today's session. As I said at the beginning of the session, this is something that we are trying. This is one of our first large-scale virtual events, all-day events, that are focused on a specific topic from start to finish. And what we wanted to do is hear from you to help us evolve these sessions in the future. You really are going to help us strengthen and improve our education, not only this type of event, but all of our education in the future. And we do look at all of that. Again, it is a CMS survey, and we want to know how we did, what we could do better, what we could offer you in the future that would assist you in your Medicare journey. So I want to thank you all in advance for providing with that feedback and helping us evolve these sessions in the future. And we do look at that, so we just want to bring to your attention some of the changes that we have made beyond additional topics based on that feedback. Some of that feedback has allowed us to institute or change how we do our YouTube videos. We're actually adding chapters. There'll be chapters to this recording as well that we will be able to allow for jump points to specific key moments within a session. So that is all based off of provider feedback, along with training indicators. And you probably saw those with today's session. That'll help you break down the education that we offer. It's so varied. It'll help you break down which sessions might make sense to your unique situation. So we want to thank you for that type of feedback. And this is just an example of how that strengthens our educational programs. So with that, I would like to thank you all for attending on behalf of myself, Aline, and the entire Provider Outreach and Education team. Has been our pleasure to provide these sessions to you today. I hope you're attending the next couple of sessions that we have, and we look forward to you attending education in our future. You may now disconnect and prepare for the next session. Have a great day.